Just to let everyone know, recording has begun.
Morning, everyone. This is Sheriff Allen.
Good morning, Sheriff. This is Jim French.
Good morning.
Morning, Dave.
Good morning, Dave.
Good morning.
How's
Morning,
everybody?
Dr. Stringham.
Oh, good morning. How's everybody doing?
We're doing well. How about yourself?
Good, good.
So just for some quick information, this is Stephen with KWNA, and I've finally got it set up so that when I do interviews, they can now go onto my website in their entirety.
Mr. Chair, I believe we have everybody.
Okay, great. I'm showing about 8:59 right now, so I'll just wait until the 9 o'clock hour and go ahead and get this thing started.
Also, recording has started.
Great, thank you. Good morning, everybody. This is Commissioner French. I will be chairing this meeting today in the absence of Commissioner Tipton. And this is Thursday, February 4th, 2021, 9 a.m. And I'm going to convene this meeting of the Humboldt County Board of Health. First order of business is Pledge of Allegiance. If you wouldn't mind joining me in the pledge. Dave, do you have a flag there for us?
I do. You're off and running.
Okay. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. First order of business before we go to public comment, our county manager, Mendiola, has asked for a few minutes to address the board prior to our public comment. Dave, go ahead.
Thank you, Mr. Chair. So this is Dave Mendiola, County Manager. I wanted to start off the meeting today to just provide some comments about a letter that businesses received from me directly just about 3 days ago, I think is when it finally landed in most mailboxes. The letter was simply to announce that the Board of Health had decided to reconvene or re-engage our business educator program. This is something, as you recall, we started back in April and May of 2020, the onset of the pandemic. And the idea behind that group was simply to go out and help businesses to prepare for procedures that need to be put in place as far as wearing of masks, distancing, and that type of thing. And that was very successful because at that time, nobody really knew how to react and what exactly needed to be done. So that was a successful program. It kind of waned after a while. But later on in 2020, as you know, we had a slowdown in cases during the summer, and then we'd had a increase, a very quick and rapid increase in cases in December. At that time, during the board meeting, we had talked about re-engaging that group to get back out in the community and make sure that, we didn't have a sudden influx of higher cases, even though we knew, and we've told the state this all along, that most of this was coming, from the private sector and not the businesses and public sector. So we talked about doing that. We went about trying to organize some volunteers and getting a letter out to just alert the public of this. And unfortunately, in the letter, there is really 2 paragraphs, but one paragraph that described a volunteer walking into a business that would have a checklist and would engage the owner or the manager and go through just to make sure that they were meeting all requirements. This, of course, was received negatively, very negatively, and quite frankly, it was a paragraph that had meant to be taken out. We missed it. I missed it, and unfortunately, again, I think it gave an impression that the county was trying to make things really difficult for businesses to stay open, and were, I guess, kowtowing to the state, and nothing is further from the truth. So I wanted to apologize personally. That is on me. That was my mistake, and unfortunately it's out there now, but I just want the board to know that I apologize to all of you, to the citizens, and for any business owner or any individual citizen who was affected by this and created any anxiety. So we're in the process of trying to figure out how to respond to that. I have responded to quite a few emails with that explanation. And those individuals were very kind and nice and understood and very thankful that we responded, number one, and that there was an explanation behind it. So I don't expect that's going to change everybody's mind, but I did want to at least make that apology to you. I will do that again at the county commission meeting on Monday. And of course, my phone is 623-6300. Any citizen who wants to talk about it, any business person, I'm happy to take any calls. So that's all I have, Mr. Chair.
Thanks, everybody. I noticed before we go through a roll call, in fact, let's do the roll call first. And I noticed that, in fact, I saw a hand up here a second ago, but I'm seeing it's gone back down. So let's go ahead and go through a roll call. I think Commissioner Tipton is not going to be here today. Ken, are you on the line? Okay, Commissioner Cherry.
I'm here.
Great. Commissioner Hall. I think I saw him on there a minute ago. Commissioner Haas.
Here. Jim, I'm here.
Great, thank you. Dr. Stringham, I saw him on there.
Yes, I'm here too.
Okay. Sheriff Allen, I already spoke with him this morning.
I'm here, thank you.
And Deputy DA Wendy Maddox. Are you?
Yes, Chairman.
I think she's on.
I am. Thank you.
Okay. Okay.
It's Commissioner Hill. I am here. I couldn't figure out how to unmute here.
I saw you there a little while ago, and that's the reason I mentioned that. But also, item 3, then we're going to go to public comment. General public comment is designated for discussion only. The public has the opportunity to address the commission on any matter not appearing on this agenda. However, no action may be taken on a matter raised until the matter itself has been specifically included on an agenda as an item for which action may be taken. If you wouldn't mind, kind of hold your comments to about 3 minutes so everybody has a chance. So anyway, we'll open this up now for public comment. Anybody on the meeting itself, the Teams site, or anybody who happens to be on the phone, *6 to unmute yourself, and please state your name for the record first. Any public comment? Not hearing any public comment. We're going to move on to item 4, which is approval of the minutes. We have 3 sets of minutes. Let's see. We've got. I'm seeing 3 sets of minutes. One for August 6th, 2020, August 20th, 2020, and September 3rd, 2020. That is different, though, than the on the text of our item 4, which says that there are approval of minutes for April 1st, 2020 and January 21st, 2021. Dave, can you clarify that for me?
Yeah, Mr. Chair. So, yeah, it's just to approve minutes for meetings between April 1st and January 21st. So April 1st to January 21st.
Oh,
so
okay.
anything between that, it would be.
Great. It's in between those 2 dates.
Correct.
Okay, so the first set of minutes are August 6, 2020. Anybody have any deletions or exceptions to those minutes?
Mr. Chair, this is Commissioner Cherry.
Yes, go ahead, Ron.
With the absence of Commissioner Tipton, I think there's only yourself and I, if I'm right, that we're at these meetings. And so I wonder, do you want approval of all the minutes or do them individually?
I think individually is probably the best way, Ron. But you do bring a question up, though. I'm wondering, and I'm going to ask DA Maddox her opinion on this. Since we only have 2 of us present that were actually present at those meetings, do we need the 3rd person here in order to have a quorum?
Wendy? You know, this is Wendy Maddox for purposes of the record. I would just ask, since we have open meeting law that requires a certain time frame to have minutes approved, I would just ask for you to conditionally approve them for today as to form, and then we can bring them back again at a future meeting.
Great.
Mr. Chair,
Yes.
Dave Mendiola. Actually, you do have a quorum. This is the Board of Health. So we've got Dr. Stringham is a member of that, as is the sheriff.
Oh, that's
So
true.
You do have
That's
4
true.
people.
Okay.
Good point. Good point. Okay, so we have do we have any changes or additions to the August 6, 2020 minutes at this point?
Mr. Chair, Sheriff Allen, I just need to abstain from this, was not present on that, at that meeting.
Okay.
Mr.
Do we have a
Chair,
motion?
I'll make a motion to approve the August 6, 2020 minutes as presented, conditioned on bringing them back at a later date, I guess, for council's recommendation for approval. Is that how we want to do that? I'm a little confused.
Wendy Badge, purpose of the record, if you do have a quorum present, including people that were that are
Okay.
needing to abstain, if you still have a quorum, then you don't need to conditionally approve them.
Okay. I'll make a motion to approve the minutes for August 6, 2020 as presented.
A motion on the floor. Any discussion on the motion? All in favor signify by saying aye. Aye.
Aye.
Any abstentions? Any nays? Okay, motion carries unanimous. We'll move on to approval of the minutes for August 20th, 2020. Any additions or subtractions from those minutes? Not hearing any. Do we have a motion?
Mr. Chair, I'll make a motion to approve the August 2020 minutes as presented.
We have a motion on the floor. Any discussion on the motion? All in favor signify by saying aye. Aye.
Aye.
Any abstentions? Any nays? This motion passes unanimous. We'll move on to minutes for September 3rd, 2020. Do we have any additions or subtractions to those minutes? Not hearing any. Have a motion?
Mr. Chair, this is Commissioner Choi. I'll make a motion to approve the September 3rd, 2020 minutes as presented.
We have a motion on the floor for approval of the September 3rd, 2020 minutes as presented. Any discussion on the motion? All in favor signify by saying aye. Aye. Any abstentions or nays? Not hearing any. This motion carries unanimous. With that, we'll move on to item 5, which is update of the Public Health Officer presentation by Dr. Charles Stringham regarding the current status of Humboldt County response to the COVID-19 virus, including but not limited to the latest number of positive cases in the county, as well as updates regarding our other efforts to mitigate the spread of the virus, including updates on testing, vaccination, and other related topics. This is an informational item. Good morning, Dr. Stringham. You have the floor.
Good morning. Thank you very much. I wanted to lead off my comments by kind of saying a few things about what Manager Mendiola had indicated also, and partially because I also am responsible for some of this as well, and I want to explain how and help to kind of make sure that everybody understands the intent of the board and kind of paint in broad strokes. Also to be able to let you know how I feel as a business owner as well. So I think first I'd like to explain that Humboldt County, at least in the way that that I've experienced things, has always been very business friendly. I've always, during the time I've been here, it's been 25 years that I've held a license to do business here in Humboldt County, and I've always had a really good experience. I've always found the county to be very reasonable and a relatively easy place to do business. I've really had a wonderful time. And I'd also like to explain to those business owners, such as me, that the concept of being in business, and also partially to people who have not been in business and don't understand what it's like, in the end, if a person is in business, we're the last person at the trough to feed. And we survive on what's left over at the end of the month once businesses have paid our bills and done the various things, the obligations that we need to do. And there's no guarantee that we get to eat. And if businesses either have problems or there are various other economic issues that pop up, such as COVID, it can be extraordinarily difficult. And I want all business owners in Humboldt County and all citizens, people who rely on those businesses and benefit from those businesses, to understand that this board understands that. And we're very motivated. We truly, if you're in business here in Humboldt County, this board truly has your back. I can also tell you that even though I've been in business for 25 years, there absolutely are board members who are here on this board who've been in business far longer than that. So I think we really understand business, we appreciate business, and we know the realities of being in business, especially during COVID. It's my belief that the restrictions that are placed on business are appropriate, and I think that the state and various other officials are doing the things that they can. But I also want everybody to realize that it's my belief that soon these restrictions will be lifted and abbreviated, and I think that that we can all look forward to that. So I think that to a large extent, the concerns that a lot of business owners, such as me, have are going to be over fairly soon. In any case, I think things will have a happy ending in this respect. I also like to express that the primary way that this board has always motivated the public and the people who we represent is by coming up with compelling messages and by explaining the reasons why things are so important, rather than resorting to strong arming or spying or levying fines or anything of that nature. So I think it's critical that at least my perception has been, both as a business owner and as a board member, that this board really is very business friendly and that we're really trying to do the right things. I'd also like to explain that when the concept to put this volunteer health educator program together was originally designed, that the idea was mine. And the reason was because we knew that businesses had a lot of ideas, and who better to approach with safety questions that the county had than the businesses themselves. And so to a large extent, this was originally set up as a way to be able to harvest and share information from the very businesses that were doing things the right way. And one of the things I'm particularly proud of is the fact that up until approximately 45 to 60 days ago, there had not been a single case that we knew of that had been spread at a local business, which means that our businesses are the very reason why we've done as well as we have. So if you're a business owner, it's very critical that everybody realize, that you realize that we really appreciate your efforts, and that we think the reason that things have gone quite well in Humboldt County in general when they have is precisely because of your efforts and not in spite of them. So we appreciate business owners. We realize that some of us really have known very well how difficult it is to be in business, especially at this point. So understand we have your back, and in no way do we have an adversarial relationship with you. Thank you very much to each of you who are doing these things. And also, as Manager Mendiola has said, if anybody has any questions about the original intent of this program and the nature of the information that's used, or anything else, please feel free. I'd like to throw my hat into the ring along with Manager Mendiola, that you can call me also, and I'm happy to discuss absolutely anything. So this is something that's being done for the benefit of the community, to keep people safe, to make sure that that resources are shared and that the right things happen. And at no time has this board taken an adversarial relationship with the people who we represent, and we never will. I want to talk a little bit about vaccines at this point. So I know that there will be some other people who are on this morning who share a little bit about this, and kind of in terms of where we're heading with vaccinations, and some good news, I think, that I'm really happy about. But first, I'd like to talk a little bit about what I would consider to be a forecast of what's likely to happen. And this is really not a small detail, more of a high altitude overhead approach that you're able to kind of see where I think we're heading with the pandemic and what's actually going on at this point. So first, a lot of experience dealing with the pandemic. earlier in the year. And I think most of us remember that when the weather warmed up, that people weren't staying inside quite as much, and people were distancing a little bit better, and also various technical reasons that involve the virus specifically.
Oh.
It just doesn't seem to spread as efficiently in summer months. So here in about 60 days, weather will warm up, and I think that's going to give us a major reprieve from the virus. The other issue is that in general, the reasons that our cases had flared up during late November, December, and January was primarily because of the holidays, people's travel habits, and gatherings, get-togethers that are common at this time of year. But those influences are gone at this point. And so what we've noticed is there were days that, there were 30 and 40 cases that we were seeing during a single day. And at this point, some days we're seeing 2 or 3 cases. It's a relatively small number. So each of these things are combining and producing a really good picture that we're seeing. So first, the reduced number of cases that we're seeing. Second, the warmer weather that we have that hopefully will be here fairly soon. And then third, the vaccination. The vaccination is things I think in general are going very, very well. Nationwide, we have approximately 32 million people who've been vaccinated so far. Humboldt County's primary issue at this point is navigating through the shortage of vaccinations. So it's my belief, based on what we're seeing, that Humboldt County is doing the absolute best that we can. Our infrastructure is really impressive. The various organizations, public health nurse, primarily, it is just doing a fantastic job. Some of the outside vendors who have and are going to be coming in to help with this effort at Humboldt General Hospital, I think everything's going fantastically. The limiting reagent in all of this is the fact that we're not able to get the vaccinations that we need. And so I know that quite a number of people are working on getting additional vaccinations, but the clinical picture still looks really good. And the reason is because of the holidays getting further and further in the rearview mirror, and also the warmer weather that we anticipate. So I think those are going to be the primary reasons why things continue to go well. And then the vaccination will help to hold down any future flare-ups. So I think that the picture is looking good. I suppose I shouldn't say this too loud, but I think that the worst of the pandemic is behind us, and I think that of each of the predictions that I'm making and each of the various issues upon which this prediction is predicated all come true. I think that we can look forward to much better times ahead. There's one other possibility, and I know that people are talking about this. I want to address this. Part of it is a little bit of teaching, and part of it is kind of a prediction about what may happen. You know that people are talking a lot about mutations, and the big concern is that at some point there may be a mutation that gains the capacity to get past our vaccinations. And I want to explain why I think that's relatively unlikely. Number one, this vaccination, each of the 5 vaccinations that are generally available or will become available fairly quickly, the 2 that we're working with so far, each of them, all of those vaccinations, they target the spike protein. The spike protein can only change so much. That's the primary thing that's mutating. And each time the spike protein mutates, it has the capacity to more effectively or more efficiently infect people. And but it has limitations in what it's able to do. The spike protein can only mutate so much and still be recognizable by the ACE2 receptors, which is what the spike protein works on. So if it mutates that much that it's no longer recognized by our vaccinations, then it would be more likely than not that the spike protein would no longer be adaptable to the ACE2 receptors. You can only change so much and still do your job. And the other issue is that because we have 2 commercially available vaccinations in the United States and 3 more that will come fairly shortly, I think, most notably the Johnson & Johnson vaccination will be inbound fairly quickly. We have so many different options for vaccination at this point that even if one of these spike proteins mutates in a way that it's not really given immunity, or we are not given immunity by the vaccinations that we have currently, what will wind up happening is more than likely one of the other vaccinations will be somewhat better, and we could just increase production capacity on those. It's possible that we may have to tweak vaccinations in the future, but I think the future is still looking very bright as far as this year. I'd like to talk a little bit more about our public education program, and then I'll wrap up my comments. We are in the process at this point. The school district has asked that we do a dedicated Ask Me Anything program, and we're planning on doing that here in about a week and a half. I'm looking forward to that, being able to share some information with some of the rank and file people who work at the school district, and also very excited to be able to do this at some of the local mines. Shane, who I think is on the call also, and I have emailed, and we'll be setting up a program to do at the Nevada gold mines. And hopefully in the future, other mines will ask us to do this too. If there are any specialty businesses or other people who have access to large numbers of people who they'd like to be able to educate, please reach out to us and let us know. I'd like to close my comments by saying that I think I speak on behalf of the entire board that we really appreciate our local businesses. We appreciate the cooperation that we get from the community members as well. We're all working through this. It's very challenging, but I really think the future is bright, and I think things have gone well. Thank you very much.
Thank you, Dr. Stringham. I had several questions I would like to pose before I open this up for additional questions. Has there been any government response to the governor's letter questioning vaccination allocations to the state of Nevada? I know that's been in the news quite a bit, and as everybody's well aware, Nevada is one of the highest infection rates of the lower 50 states, lower 48 at least, and that at the same time we're number 49 of 50 in terms of allocation per capita. So I'm just wondering if there's been much news on that along that line.
I have not specifically read anything about it. I know that the federal government has come up with a number of different allocation programs recently where vaccinations are sent directly to the people who will distribute them to end users, to the actual people themselves. And I know that the nationwide trend is to marginalize some of the middlemen involved in this process, but I haven't read anything specific about this. And I know that at least at this point, the biggest single area of improvement that we could make is in vaccine production. I think people are seeing this as being an allocation issue, but it's my belief that the closer to the stem you can get, the more definitive the answers are. And I think in this case, that stem really originates from vaccination companies in their capacity to produce. It has been my hope that other companies that have the capacity, the technical capacities to do things such as vaccine production, that they would be involved in manufacturing under licensure from the original manufacturer, the designer, and we haven't seen that. To be honest, I don't know why. It's one of the areas that I think we could improve the best. I think a lot of citizens here in Humboldt County look to the county to answer questions, and I know the county looks to the state looks to the federal government, but in the end, really at the end of the road, there's a manufacturer that just does not have the production capacity to make the vaccinations. That's really where our attention should be focused.
Great, thank you. And one last question. I had this from a constituent that asked whether there will be a policy in place to document vaccination. Idea behind it is, for instance, for some airlines, for instance, you can't get on an airplane until you have proof of vaccination. Are we planning on putting some sort of documentation together for following a completion of a vaccination?
I know that everybody who's vaccinated at this point does receive a document. It's a kind of a small abbreviated driver's license sized document that indicates that we've been vaccinated. And beyond that, whether there would be a database or anything of that sort, I'm not sure. I can certainly look into that. I know that each of the vaccinating agencies do keep records on who's been vaccinated, on various reactions and things of that sort. So I know that the data does exist. And in addition to the individual end user, the vaccinated person, being able to get documentation. But how that's kept and who has access to it and whether it would be discoverable by other people, I'm not sure.
Okay, well, that's something that we probably ought to take a peek at later on because there are some questions along that line. Were there any questions of Dr. Stringham before we move on this item? I saw a hand up here a minute ago. I don't see it now.
Commissioner French, this is Susie Esquivel with the Community Health Clinic. I do have something to add to that. Marsha's not here today, so I'm sitting in for her. But the question about a database, Nevada does have a web IZ registry. It's a web immunization registry that anyone in Nevada who does vaccines enters these vaccines into the database. That's how we keep track of all the vaccine that we're allotted here. And any patient, client that comes through our pods, comes to our clinic, that vaccine is entered into WebIZ. So there is a record of that vaccine digitally, as well as the client receiving that immunization card issued by the CDC.
So is it your thought then, Rita, that that CDC card will probably suffice as the documentation necessary?
I believe so. And, you know, if a client needs more than that, so we can print out the record showing on an official state of Nevada form that shows that they've had both of those vaccines as well. I mean, it prints the way it prints it with all of their vaccines. If they've had more than just the 2 COVID vaccines, it'll print more than that, but there is a digital record of that as well.
Okay, great. So if anybody's really looking into that for a passport or for a visa into another country that's going to require that they can actually obtain those records from Nevada. So a web-based record.
Yep. Yes.
Bring it back next time.
Okay.
And from what we've been
Was
told,
there a sufficient number of
There
people?
was, yeah, because it's the health board, so Sheriff.
I heard the discussion.
Sheriff
that
Stringham, yeah.
We've got some background noise on here. Could everybody, anybody that's not on? Okay, go ahead, Rita.
our WebIZ, the people who work on that from Carson City with the state, we are well ahead of the curve with national databases. From what we understand, Nevada has a very, the web registry is actually for the immunizations is ahead of the game when it comes to, in comparison to other states, is from what we've been told. Right now, clients themselves, if they provide certain information to the clinic where they are getting these vaccines, or any vaccine for that matter, they we can give them access to just access their own immunization record as well.
Great, thank you.
You're welcome.
Did any of the board members have any additional questions of Dr. Stringham on this item? Commissioner Cherry, did you have anything?
I have no questions, but I want to thank Dr. Stringham for his report, and it's great to hear that we are once again heading in the right direction. Thank you, Dr. Stringham.
Thank you very much.
Commissioner Hall, did you have anything to add? Commissioner Haas, did you have anything to add?
No, I don't have anything to add at this time. Thank you, Jim.
I'm sorry, Commissioner Hill, did you have anything to add?
I don't have anything right now, Commissioner French.
Great, thank you. And Sheriff, did you have anything, any questions of Dr. Stringham that you would have?
No, just to follow up a little bit on what you said, I did reach out to both Cortez Masto's office and Mark Amadei's office, and spoke to them about seeing if we can get an increase in allocations. Amadei's office is looking into it. They're both looking into it, but I do think it would be a good idea if we can get as many calls as possible to those to see if we can't get an increase in our allocations for the vaccines. Thanks.
Sheriff, thanks for taking the time to do that. I did as well. Contacted them. I think I think the explanation I have heard so far has more to do with a complex allocation formula that's not just based on infection rate in the state. And I think ultimately, I think that based on a number of criteria that we evaluate on a weekly basis, having to do with our infection rate, has to do with per capita infection as well as ICU beds that are occupied, and whether or not we're approaching the point of overwhelming our healthcare professionals and hospitals in particular. And so I would just recommend to the board members that we need to keep ringing that bell in Washington, D.C. They need to understand that we're on the tip of the spear on this thing, and that we really do need. We're not asking for everything, but we're certainly asking for additional consideration with regard to vaccine allocation. So, did anybody else have any questions of Dr. Strangham? Okay, then we're going to go ahead and move on to item number 6, and it's an update from Humboldt General Hospital. It's a presentation from Humboldt General regarding hospital status from current cases, hospitalizations, testing options, antibody testing, and other related activities. I don't have a name on my agenda here for who will be representing Humboldt General, but is there somebody on that could represent Humboldt General Hospital for us?
Hi, this is Robin Dunkhorst, the Chief Nursing Officer. How are you guys?
Good, Robin, welcome.
So, quick updates for you. The Atelica machine that'll do antibody testing should be online on the 15th of this month. We have engineers here to get that finally rolling. Cases are down internally. We only have one inpatient with COVID right now. The ED's volume for COVID has been very manageable. The screening clinic has seen reduction of volume for inpatient or in-office visits with the provider, as well as drive-through swab. So we're seeing, a significant reduce of the burden over the last probably 3 weeks. We also have partnered with Sean and Marcia and have been working on a collaborative vaccination for the community effort that should hopefully start the tail end of February, just like you guys have been kind of talking about over and over, is the allocation issue. So that's a big chunk of the concerns with moving forward, and how the logistics of how to roll out vaccinations collaboratively is a problem when you don't know how much you're getting. When it is a huge issue, but we have a really good plan internally on how to start that. We're meeting weekly to line out the plan, and we'll pull the trigger on doing some kind of marketing layer of that once we get a couple of other things ironed out for communications, as well as the allocation issue, because it's very hard to tell the public that we can do something when we can't do something based off of our lack of ability to procure vaccinations, or even having the knowledge of what we're getting like with foresight. So that's the only problem that we foresee with helping with vaccinations, but we're definitely gonna do it. So that's where we're at. We're gonna demobilize our Rampart structure, which is in the parking garage on the kind of right side of the hospital, because we are not seeing that we're going to need that, knock on wood, anytime soon. And so we can reopen that parking garage for patient access and ease of traffic through the hospital. We've been having internal discussion about opening up our visitation a little bit more, like that's kind of going across all of Nevada this week, with hospitals trying to open up their tight control on visitation. What else are we working on? That's pretty much it as far as updates for you guys. You guys have any questions?
Thanks, Robin. Are there any questions of Robin from Humboldt General? Sheriff, did you have any questions at all?
No, Mr. Chair.
Commissioner Cherry, how about you?
Yeah, I want to follow up on a question I had last meeting with possibly getting a team that would get out to the rural areas. My concern is for maybe the older folks who have trouble getting to town to get the vaccines, not only once but twice. Whether we talked maybe there could be a possibility that EMTs could do it. Have you had any further discussion about that?
I know that Marcia had a plan and thought on how the community health side was going to help work with that. Allocation is the biggest issue when you're only getting 100 vaccinations a week, and sometimes not even that, and you're still trying to do second doses with that. But I'll keep that on the radar, and I'll bring it up at our next week at our internal vaccination meeting to see at what step when we could actually, and I think that will come more clear once we start rolling out, our vaccinations to the public. We'll be able to see how we could do that a little bit better. We've just got to kind of get it rolled out and work the kinks out as it rolls out, and hopefully as allocations loosen up and we're able to get more vaccinations, that we could definitely do something remote for those, Humboldt County residents for sure. I mean, I see it as totally doable. It's just a matter of procuring the vaccinations.
Okay, thank you. I think that would become easier too now that I've heard about the Johnson & Johnson vaccine that only has to be given once. That could be an advantage to us in the remoter areas of Humboldt County. Only having to get.
For sure.
Mm-hmm. Thank you.
Great, thanks. Did any additional questions from Commissioner Hill?
This is Commissioner Hill. I don't have any questions at this time.
Great, thanks. How about you, Commissioner Haas?
This is Commissioner Haas. I don't have any questions at this time.
Great. And Dr. Stringham, how about you?
No, I sure don't either. So.
Right. Okay, thanks, Robin. We'll look forward to talking with you next time around, having to do with the rollout of the vaccination program at the hospital, as well as the satellite vaccinations in the rural portions of the county. I guess we're going to move on to item 7, which is update from local manager on county response to COVID-19 coronavirus. Update from Sean Wilkin regarding the efforts of local emergency manager to provide support for the COVID-19 outbreak and activity related to the ability of personnel, protective equipment, and testing reagents, including an update regarding the rollout of the vaccination plan and availability of vaccinations in Humboldt County. Sean, are you on?
I am. Can you hear me all right?
Yes. Go ahead, Sean.
Good morning. So a couple things on the vaccinations, because we did see our allocations cut down. So likewise, everybody else, I have a weekly vaccination meeting planned with the state of Nevada, and I continue to, I use the term advocate for the purpose of this meeting, but argue with them over our vaccine allocation every week and push for more. So that's worked out for us in a couple ways. I also reached out to Ryan from Amadei's office. I think a lot of us did. This week, for our upcoming allocation, we are going to get 200 instead of 100. So that was a win with that. With the Safeway pharmacy coming in for the 65 and older, and that was part of the federal pharmacy partnership program that the state put together, and we brought that resource in. Originally, we were allocated 400 vaccines. Those appointments filled up in 17 hours from the time that information went out. I asked for an additional 300 from Safeway, and we got an additional 200. So yesterday and today, we are vaccinating 600 people in our county, age 65 and older, and they are returning to come up and do the second round of doses in 28 days for the folks that received that. And that was a huge win for us. Getting to 200 vaccines coming in, that's also a huge win for us. Me and Marcia and HGH, I know Robin touched on this, we had a good collaborative meeting with everybody. And our goal with that is sustainment, continuity of operations, and being able to make sure that we're keeping the vaccine program moving forward. And I just got off the phone with the state since we've been on this meeting. We are going to see Walmart pharmacy coming in. One of the capacities that Walmart pharmacies has and why they were chosen, and this goes to Commissioner Cherry's comments, is they do have the availability of strike teams. So at 1 o'clock today in my meeting, I'm going to get more information on that. My plan is Walmart to get the strike team so we can get up to the outlying communities and start taking care of them. I know that's of the utmost importance. And I also spoke with Dave Mendiola yesterday, and we're going to look at maybe a local group that could help us out with some transportation for maybe people that don't have transportation, but they don't have medical needs with that transportation, so we can get them in to get this vaccine. So we are moving forward. We have had some wins despite some setbacks with vaccine allocation. I can't explain to everybody how frustrating that is because it does make planning extremely difficult. In our meeting, one of the things that came up is there are people from a neighboring state going into 2 of the major counties here in Nevada to receive the vaccine, and CDC put out guidelines that states essentially you can't discriminate against people based on their locality. And then that started getting people to try to push out to the rurals. And so we've had phone calls from people from out of the area, and we've asked those people not to come up and receive the vaccine in our community because we just don't have enough to start giving out to the other counties. So we're working on that, being diligent with that. We are working through our continuity of government operations now. We're moving in through, they don't refer to them as tiers with the new playbook. But we are doing a good job of working into our frontline community support. We're going to continue with education and those groups that we've been working on and hopefully see us moving into the frontline supply chain and logistics next. And that's good for our community because that's also going to bring us into the agriculture and food processing areas as well as our supply chain so we can start getting those folks done. So while the allocation issues and things like that haven't been the greatest and it's caused some navigation things for us. I think everybody working together and everybody continuing to advocate for our county, from the county commission, from my office, Dr. Stringham, Sheriff Allen, and everybody that's been involved, we are starting to see some wins with this. And I do want to keep that positive mindset moving forward. We are working to take care of the community here. You know, all the time and effort that everybody's putting into this, we're seeing good things happening. And hopefully we can keep moving forward. When Walmart comes online next week, Walmart's allocations are separate from what we receive from the state. So that is going to increase the quantity of vaccine that is coming into our county. Part of what we need to work out this afternoon in my vaccine planning meeting that I have is what group is Walmart going to take care of? And what are their guidelines? Because as we move through our essential workforce, after we're done with Nevadans that are age 65 to 69 and then 70 and older, we have our follow-up pod from Marcia's for our 75 and older group. So we're getting through these folks. We move into Nevadans 16 to 64 years old with underlying health conditions. And so we're going to have to determine after we move through these other groups and we get to that, which is in the future, that's not a right now, the vetting process for that. And kind of have in place there with those things. So, you know, as we move forward, we'll keep everybody informed on what's going on and keep trying to do the best that we can for everybody that's involved with this.
Great.
Do you have any questions?
Thank you, Sean. Are there any questions for Captain Wilson?
Mr. Chair, Dave Mendiola, County
Go
Manager.
ahead, Dave.
I wanted to share with everybody, since we're still talking to vaccinations, and there was the question about whether or not there is a card or something that an individual who's been vaccinated can show at the airport. Let me share with you my screen. This is what they gave out yesterday, and I think it's the CDC form so that everybody can see that. I think I got it right here. So you should be able to see that. Can you see that?
Yeah.
Yeah, so this is the form. There's two sides to it. And so it's got the first and second dose. There's some additional information on the back, but I just want to that's something that anybody could put in their wallet. So I just wanted to respond and show you what vaccination folks are getting when they leave.
Great. Thanks, Dave. Do we have any additional questions from Commissioner Cherry?
Yes, thank you, Sean. The 600 doses that Safeway was allocated to administer here in Humboldt County, were all those vaccinations used? Were they signed up for?
So right now, the plan was to do 300 a day. Yesterday, we did use all 300 that were planned on that day, and we're anticipating the same thing today. So we had zero waste from the first half of the pod yesterday.
Okay, so we are still turning 65 and older people away yet. There hasn't been enough vaccine to do everybody that wants to get vaccinated.
Not yet. So we still are, but to kind of put that in comparison, moving through what was tier 1 under the previous guidance, we did right around 300 people, a little over 300 people. But we're also able, with the school districts, put us up close to 400 with age based, so 65 plus and 75 plus. Between this and the pod we held up at the senior center, we've done nearly 900. So the largest population group in our county to receive vaccine has been our residents 65 and older.
Very good. Thank you.
Great. Sheriff Allen, did you have anything to add additionally?
He does not.
Okay. Commissioner Hill, how about you?
This is Commissioner Hill. I do not have anything. Thank you.
Okay. Commissioner Haas, how about you?
This is Commissioner Haas. Sean, I just want to thank you and all the others involved in this for all the work you're doing.
Thank you.
And Dr. Stringham, did you have any additional questions?
Yes, I do. So the first, I'd like to say, Sean, the work that you guys are doing is absolutely fantastic. This truly is really important stuff, and I think that of all the things we can be doing as a community, aside from the distancing and face mask wearing and these kinds of things, this is really important. I do have a question. I guess the question is that it seems like at a county level, we're having a difficult time getting the vaccinations, but it seems like the pharmacies are having an easier time getting that. And do you think that maybe in the future our strategy should really revolve, at least in the short game, around getting more pharmacy mediated vaccinations and fewer HGH and public health nurse vaccinations, purely because it seems like it's easier for the proprietary pharmacies to be able to actually receive these?
So that's an interesting question. And no is the best way that I know to answer that. It isn't necessarily easier for them. So in the case of Safeway, the vaccines that they brought were vaccines that were allocated to the state of Nevada. And those were allocated to the pharmacies. And we were fortunate. Now, initially, it was the 400 where we get that bumped up. Bumping it up, that took about a week to accomplish and to work out. And we were able to get the extra allocation. Walmart and bringing Walmart in, their allocation does come directly from the federal government. However, because we've seen a fluctuation in the allocations and we do have the folks coming in from other communities into the larger counties, I don't know that we can directly rely on them, because as a county and as an emergency manager and as health board, everybody in the process, we don't have the ability to manage what it is that Walmart is able to get, or necessarily to advocate for what Walmart is able to get. We only have the ability to do that for the vaccine that we're receiving. Now, we do have the ability to provide guidance and direction to Walmart as to which groups they are vaccinating. And that's something that, we have to work out and that we're going to work through, so to make sure we ensure the continuity of getting through everybody in the most efficient manner we can. I should know what they get week to week, and I should receive that information from the state. But if they only get 100 1 week, it's not like in our case where, we got 100. I complained to anybody who would listen to me about it, and was very, very vocal with the state and anybody who listened to me about my opinion. And I know commissioners and everybody else here involved with us as well. And our allocation go up. I look at them as a partner, and I look at them as part of the solution, but I don't, either on a short game like you're bringing up, I don't know that they are going to be the saving grace to higher vaccine allocations in our county, because I don't know what they're going to get, and their allocations are separate from the state. So I'm going to have to figure out, am I correct, communicating directly with Walmart on this process? Are we going to have a point of contact with the federal government on this process? How are we going to get this information and be able to manage that? So I just look at them as another piece of this great big puzzle that we have with trying to put vaccinations together and move forward that way.
Thank you very much.
Sean, this is Commissioner French. As this thing morphs, as this whole vaccination protocol morphs based on availability and whatnot, would it be? I'm wondering whether or not we should have an invitation go out to Walmart and the other pharmacies, the other 2 pharmacies in town, as well as Golden Valley, to determine what communication they've had with regard to independent allocations of vaccine. It would seem to me this would be the vehicle that we could actually get them into the same conversation and actually have a conversation in this forum, for instance, with those pharmacies to determine, as this thing moves down the road, determine what groups of people each could target, so to speak, with lack of a better word, and then possibly allow this board the opportunity to pressure Washington, D.C. with regard to some of the private healthcare providers, such as Golden Valley and Humboldt General. Am I wrong on that?
No, I don't think you're wrong. And I think that any information that we send up as a county that represents our citizens and what we need to do here is good information. So with the pharmacies, initially, I try to bring all 3 of our local pharmacies online. So Olson's, Ridley's, and Walmart. And that was my goal. That's what I advocated for and had discussions about. It's not a chain pharmacy. And so on this program, they enlisted chain pharmacies, and Walmart. So Ridley's has reached out to us. I've had good discussion with their pharmacy director. There's been some discussion between Ridley's and the state, and then me and the state board of pharmacy as well. One of the reasons that Walmart was selected is it is based on capacity, things like the strike teams, continuity of operations, and things like that. It sounds like there was a couple of hiccups with Ridley's pharmacy over in Elko getting enrolled, and then apparently the pharmacy closing. So that was concerning to the state. Todd that I talked to from Ridley's was great as far as they can set up schedule appointments and do some online things. But Walmart is enrolled. So for Ridley's to do this right now, it sounds like I would have to transfer an allocation of our vaccine in the county to Ridley's for them to administer. The issue is on 100, if we end up at 100 doses a week, 33 to the community health nurse, 33 or 34 to one of the other entities, and 33 to the other entity. And then we end up kind of spreading it thin, and that's in its own way creates more issues than it would be worth. So right now, I think that the partnership with HGH that we're going to have going forward with that plan is going to help to diversify the workload and diversify our care providers for the community. And then with Walmart coming online and them working with the feds and having the strike team capabilities and some of these other things that they look for in these criteria, That's probably our best bet. If Ridley's is able to get online and get their own allocation, then I'd like to see that. And where Olson's is not a chain pharmacy, the State Board of Pharmacy is still working on those things, and that's at the state level. So I don't know the details on that portion of it yet.
Okay, so I think ultimately, this Commissioner French again, so ultimately coordinating those activities and those groups of people that they will be servicing, we probably at least should have a place mark in these meetings so that we can discuss that and actually put some continuity into the message that's going out so that the folks can actually have an idea as to what is available, and secondly, give us an idea if we can coordinate those groups of people that could be serviced by those independents. This would probably be the place to do it, I think.
And I agree with you. And that's our goal. When we do that, page 32 of the vaccine playbook, we do still need to follow those guidelines as a health board. That way we don't do anything to compromise our allocations. But I do think that the coordination is a good idea. I think the public information is a great idea. The other good things with these pharmacies, they have their own scheduling abilities and their own capacity for people to be able to call in and talk to them, people to be able to make appointments and set appointments and do those things. So if we can, as a board, do what you're saying, Commissioner, put the information out and guide people into what pharmacy is doing what, then those pharmacies are able to schedule the appointments and set people up to come in and get the vaccine.
Great. That's exactly what I was thinking. Thanks.
You're welcome.
Any additional questions?
Hi, this is Zach Sherburne. Me and my wife have a small business here in town. I was just curious, is there a number that you guys have as far as people that have already had the virus and then the vaccinations that'll start allowing to open the county more? Like with the combination of people vaccinated and people that have the antibody, like is there a certain point we can get to where we can start opening the county? Do you guys have a number, or are we just going to wait till everybody's vaccinated to open it back up again?
Dr.
I may be able to answer that question.
Go ahead, Dr. Stringham.
So it's a kind of a complex, multifaceted question, but kind of the simple answer is that there's a certain number of people who receive immunity who then make this virus less spreadable in a population. And it depends on the number of people who are vaccinated, the number of people who are infected, the number of people who still have immunity, who have been infected, a number of different things. It's kind of the concept of herd immunity. We don't have, to answer the question directly, don't have a specific set number. Herd immunity tends to really not be protective at all, not even a little bit, until we hit at least 55%. And we're nowhere near that at that, but probably not even half of that at this point. And so I think that there's not really a number. I think in the end, guidance of this nature typically comes from the governor's office in terms of lifting restrictions. And so that's really where that particular guidance is going to come from. Here on the 15th of this month, we're anticipating that guidance will come in the form of at least a partial abbreviation of businesses, limitations of occupancies and things of that sort. But stay tuned as far as that goes. There is, by the way, you'd asked about a number. There is a phone number that you can dial into, and it's 375-3200. And you can get up-to-date information that's updated very regularly by the county. And when there are major news bits that come out or new developments, very frequently there's an update that will reflect that. And so that would be probably your best source of up-to-date information. And then just continue to tune into these health board meetings that we have for additional information. Does that answer your question?
Yeah, thank you.
Okay, thank you.
Great. Is there any additional questions on this item? Okay, then we're going to go ahead and move on to the next item, which is the update from the Public Information Officer. And this is a presentation by Nicole Maher, Humboldt County Public Information Officer, regarding the current status of Humboldt County response to the COVID-19 virus including but not limited to the latest number of positive cases, public relations activities, including a plan to hold a series of community information meetings that will be live and allow residents to get latest information and the opportunity to ask questions of county personnel, including the status updates regarding other efforts to mitigate the spread of the virus. And this is for information only. Nicole, are you on?
I am. Excuse me, I am. Can you hear me okay?
You bet. You have the floor.
Okay, thank you so much. And just to add to the great information that Dr. Stringham just shared with, I apologize, I didn't catch the gentleman's name, but yesterday the state actually added a dashboard tab to provide weekly immunization numbers. So if you go to Nevada Health Response, if you just Google Nevada Health Response, that will come up, and the page includes total doses reported as administered in Nevada WebIZ. That's the program that Susie Esquivel was talking about. Total vaccinations reported as initiated, so that would be first doses, and then total vaccinations reported as completed, so that would be second doses. And then it also gives kind of the rate per 100,000 Nevada residents, which kind of regulates across the board. So you can see how Humboldt compares to the rest of the counties. And so check that out. That was a really cool addition that they added yesterday. So in our county, Humboldt County reported 200 cases of COVID-19 in January. So just to give you some comparisons, in December we did 458, in November we did 176, and so far as of yesterday, we had 11 cases. Actually, that's just the 1st and 2nd of February. We didn't have any report from the state yesterday. Humboldt County's positivity rate is 8.4%. That might not sound great, but it is significant considering that 2 weeks ago we were at 19.7%, and 4 weeks ago we were at about 40%. So really excited to see these declining numbers. Our case rate and is also coming down significantly, and we're still averaging about the same amount of tests a day. Everybody across the state is down maybe about a quarter, and we are too. So we're at 228 a day average. Just to let you know, you might have noticed that we aren't reporting on Fort McDermott right now. Dr. Jacqueline Bay and APRN Terry Cargile have both resigned from the clinic, so we've lost our contact there. So we will not be reporting numbers from McDermott unless we're able to make contact with new providers who are willing to provide that information. As just a reminder to our public that Fort McDermott has chosen to report separately from Humboldt County. So that's that piece. This past Monday was the 12th week in a row that Humboldt was flagged by the COVID-19 Mitigation and Management Task Force for a high case rate and high positivity rate. But I think as Alicia Heiser will help us understand, that probably is going to go away. So we are pretty excited about that. And as Dr. Stringham said, we are in a pause until February 15th. So we probably won't see much action on that until the pause is lifted, which we are hopeful it will be. As we have discussed here, and Dave Mendiola and Dr. Stringham have both mentioned and shared great information, we did send out a required letter to our community businesses that was required by that task force. And we failed miserably at explaining the purpose of the business educator program. I failed miserably, for which I completely take full responsibility. Dave Mendiola is being very kind, but it was not his fault. It was my fault. And Dave has been helping me prepare a new letter and some different things. And we want to kind of meet with, Dave's going to meet with the health board, the commissioners, and review that. I just really want to thank all of our business owners for being understanding, and tell them that I completely understand if they're not understanding. I also want to thank the commissioners and Dave and others who have fielded those phone calls, and just apologize again. And I think we'll talk a little bit more about that during the mitigation plan part of this meeting. With regard to hospitalizations, you heard Robin Dunkhorst say that we just have one currently hospitalized. No local ventilators are in use. That also is wonderful news. Hospital's been running 6, 7 a day, and so just love to see those numbers. Yesterday, so Dave mentioned just this really important piece, and Sean did too, Captain Sean. But yesterday we began the first of this 2-day vaccine distribution out at the exhibit hall, and boy, we had a difficult time arranging for transportation for some of these folks. Some of the families actually had cars, but they couldn't get some of our seniors into the cars because they were too low or they were too high, and it just really brought into perspective how important these kinds of vans and different things are, and so just had a very difficult time arranging for transportation through some of our available resources here, and so we're excited to see what Dave and Sean are working on as far as providing some of that support to be able to transport people to get vaccinations. And our informational phone line, that's the number that Dr. Stringham shared, the 375-3200. That is a recorded information line. And we change that out every Monday and Thursday for sure, but we actually have been changing that out pretty frequently over and above that. We just share what our latest vaccination information is, anything that would be helpful to people to know where we're at. Also on our Humboldt County report, I've started including a flyer of the parallel lane structure, the prioritization schedule, but just kind of including in red boxes about where we're at. So if people want to take a look at that, I can share that on the social media sites as well and on our website. We also, Humboldt County IT is helping me set up an additional line for Spanish speakers. Just to give you an idea, our Spanish-speaking population and our non-Spanish-speaking population are about neck and neck as far as COVID confirmations. So that is definitely a very important population that we want to target. So as soon as we have that number or information, IT isn't quite set yet on whether that will run through the same phone number or whether it will be a different phone number. But as soon as we have that information, we will share far and wide as well. Just to give you a quick situational report from the state, everybody's case load is down. About, as far as I can tell, about a third to a quarter to a third. And testing numbers are down as well. State is up about 15,000 cases, but that's 2 weeks ago, we were at about 25,000 cases, up about 510 deaths from 2 weeks ago. Again, that's about 2/3 of where we were. Humboldt, we are currently at 1,024 cases. That's up 37 cases from 2 weeks ago. We are also up 1 death from 2 weeks ago. Washoe, numbers coming down really nicely, just up 1,500 cases from 2 weeks ago and about 36 deaths from 2 weeks ago. Clark, up about 12,000 cases, up about 400 deaths. Lander up 10 cases, no change in deaths. Pershing up 50 cases, again being driven by the prison. 18 deaths, that's up 2 from 2 weeks ago. And Elko, doing better, continuing to struggle a little bit, up 149 cases from 2 weeks ago and up 4 deaths. So just to give you a quick update on the state's vaccination efforts, remember last time I mentioned that we were just in the doghouse. We just looked so poor compared to the rest of the nation. That has changed significantly. We are now showing that we have processed 76, almost 77% of doses received in the state. We are currently leading all states and territories in FEMA Region 9, including California and Arizona, when it comes to percent of doses administered. And I chalk up some of that to our own wonderful people, Marcia and Sean, and all the folks helping with that as well. As I mentioned, yesterday the state added that dashboard to cover vaccines, so check that out on Nevada Health Response. State's positivity rate is down from 20.5% to just shy of 17%, so excited about that. 5 additional cases of that new B117 coronavirus strain have been detected in Clark County. All 5 cases were close contacts of the first case, and they feel like they've probably, hopefully, narrowed in on that. As you might remember, that strain is thought to spread more easily, but not believed to cause more severe illness or increase the risk of death. And so loved Dr. Stringham's comments that hopefully we won't see any kind of surge from that. And just as far as occupancy rates, 76% statewide hospitalizations, that's down from 80%, ICU 66% down from 73%, so significant dip there. And ventilators in use 37% down from 45%. That's all I have. Thanks.
Great, Nicole, thank you. Were there anybody on the call that's has any questions for Nicole? Okay, do we have Commissioner Cherry? Did you have any questions?
We haven't heard for quite some time about the contact tracing, and is it still showing that most of the cases are happening more in the private setting than in the public settings?
I can answer that question. Yes, this is Dr. Stringham for the record. Yes, it is still the case. Overwhelming majority of cases are being transmitted in private sectors, private functions, private events, households, that particular sector, and it is still the case that the number of cases known to have been transmitted in businesses, those officiated environments, are so low that I would guess the number to be less than 5 to 7 cases.
Interesting. Thank you.
Sheriff Allen, did you have any questions?
No, I just want to extend my appreciation to Dr. Stringham, Nicole, and Dave Mendiola for clearing up what was discussed earlier. I do appreciate that. Thank you.
Okay. Commissioner Hill, did you have any questions?
Yeah, that's Commissioner Hill. I just have one question for Nicole, and we can maybe put this off until the mitigation section, and if you want to, that's fine. You stated early in your report that letter that was sent out to the businesses was a required letter for the task force to put out. Can you expand on that for us to hear?
Sure, Commissioner Hill. Can you hear me okay?
Yes, I can.
Okay. So each week, pretty routinely, although sometimes we don't meet, but the state has a mitigation and management task force. And if we are flagged as a county based on those 3 things, based on our test positivity, our case rate, and our testing numbers, if we're flagged by them as being in a zone where we have an elevated disease risk, then we have to provide a plan to them. And so what happened was we've been going along and presenting our plan, and then in about late November, the task force mandated, I'll just use that word, mandated that we come up with some kind of an enforcement effort. Well, to be honest, Commissioner, we're just not an enforcement county. We felt like our businesses were doing really well, kind of based on what Dr. Stringham was just saying. We have, up until just recently, we hadn't seen any cases coming through businesses, and by and large, we thought businesses were doing okay. But the state was adamant that we needed to provide some kind of an enforcement. And so Dave just came up with this brilliant plan, as Dr. Stringham said, back in April of 2020, May 2020, Dr. Stringham had suggested this business educator program just to go around and just answer questions. Everything was so new, and nobody really understood how to operate business and do all of the mitigation efforts at the same time. And so Dave came up with the idea to resurrect that group and to we had kind of a threefold mission. One was to just provide information at whatever level a business wanted. The second thing was to provide vaccination information. As Captain Wilkins said, sometimes we have information, sometimes we don't, but we could at least provide an idea of what the prioritization lanes look like. And then the third thing was to offer PPE. The county has quite a supply, and we wanted to get that word out. And so when I say that it was required, that's what I mean. That we had to present a bit of a plan to the Mitigation and Management Task Force, and part of that plan was to send a letter out to all businesses letting them know that we were reinstating that business educator program. Does that answer your question? Is there anything else I can answer?
No, I think that's a start as far as where the roots of it came from, and I'm sure there'll be more discussion on it later, but that does clear up a little bit for me.
Okay.
Great. Commissioner Haas, did you have any questions?
This is Commissioner Haas. No, thank you, Jesse, for bringing that up. I don't have any questions.
Hey, Dr. Stringham, did you have any additional questions?
No, I sure don't. But Nicole, thank you very much for keeping us abreast of the events and the numbers and some of the specifics. I really appreciate the work that you do.
Okay. Any additional questions on the call for Nicole? Not hearing any, we're going to move on to the next item, which is an update from the city of Winnemucca on the wastewater testing. Presentation of Winnemucca City Manager Alicia Heiser to provide information regarding ongoing wastewater testing efforts and the results as it relates to forecasting the outbreak of COVID-19. Alicia, are you out there?
I'm here. Good morning.
Good morning. You have the floor.
All right. At the last health board meeting, we had just received word that our spending deadline for our coronavirus relief funds had been extended through the end of 2021, and that we were going to restart our wastewater testing program. So our first samples that we took once we were reinstated was last week, or they were actually taken on January 26th. Let me share my screen. So I hope everybody can see this. This is our wastewater results dating back to September of 2020. So we took our samples on December 29th, 2020, and our funding was supposed to end on the 30th. It then got extended, and so we started the program again here on January 26th. And I received those results early this week or late last week, and we had very little viral RNA in our wastewater, which was a very good sign. We just continued this dropping trend that we were seeing throughout December. So there's a total of 13.3 viral copies per milliliter, and we really only picked that up at the wastewater treatment plant and then in the Malarkey, Bridge, Harmony, and Mizpah area. And I'll move to this graph, which shows the blue line is our confirmed cases per day as reported by the state, and it's the same numbers that Dr. Stringham and Nicole report. And then the orange line is our wastewater concentration, the viral concentration. So you'll see that our wastewater really is predicting our spikes in cases. So we had a very large spike, and then lagging was our confirmed cases per day. And then we had this smaller spike. And again, we had a smaller spike in our cases per day. And then we've just seen this continuing trend of dropping. The viral copies in the wastewater is continuing to drop, and we are also seeing our cases per day dropping. So even though we had about a month lag in our wastewater testing while we were trying to figure out funding, I don't believe we missed any valuable data. I don't think there was any large spike that we missed or anything like that, and I'm hopeful that we'll continue to see this dropping in cases per day. That's really all I have for wastewater. Nicole did touch on the criteria that the state sets for being flagged, and so I'll just run through those very quickly, just in case anybody has questions about that. So there's 3 criteria, and if we are failing 2 of them, then we are flagged and we are considered at risk for high transmission. And so this first criteria is you fail if the average number of tests per day per 100,000 people is less than 100. And the state reports this on a 14-day average with a 7-day lag. So this graph does not have the 7-day lag because I create this graph as soon as I get the numbers from Nicole. And so anything up here in the green means we're passing, and anything down here in the red means we're failing. And so we've had good testing numbers since the beginning of November. And so we've been passing this criteria for quite some time. The next criteria, you fail if the case rate per 100,000 people in a 30-day period, and that's a rolling 30-day period, is greater than 200. And so again, red is failing and green is passing. So when we really started seeing the uptick in our numbers in mid to late October, we transitioned from passing to failing. Our cases spiked. We were up above 3,000 per 100,000 people. And then since about the end of December, we've been continually dropping. And so I expect this to keep going down, and we're in about the 700 to 800 range now. And we need to get below 200 to be clear of this criteria. And then the last one, this one you fail if the case rate per 100,000, which was the one I just presented, is over 50. And the testing positivity rate is greater than 8%. And the state reports this on a 7-day lag. So about 7 days ago, we started dropping below 8% and into the green. But because of the state's 7-day lag, we probably won't drop below 8% on their end until a couple days from now, maybe as early as tomorrow. But this has been going down continuously over the last week. And so I expect this flag to be removed, at least by early next week. And so once we're passing this one, as well as our testing number, Humboldt County should no longer be flagged for high transmission. And that is all I have as far as that goes also. So I will answer any questions now.
Any questions for Alicia?
Commissioner Cherry?
Commissioner Cherry, did you have any?
I do. This is both to Alicia and Dave. The COVID funding was extended. The county has used the funds that it was originally allocated. Have you heard from any of the congressionals or anywhere? Will there be any more additional funding coming in so that we can continue to do like the wastewater treatment, to help with some bills? Have you heard anything in regards to additional funding?
I have not heard anything concrete. There's definitely been rumblings about direct funding to local governments. The way we received the coronavirus relief funds was a pass through the state. And part of these new stimulus bills, they are including direct funding to local governments. But I have not heard for sure whether we will receive any, and I've not heard what amounts we could possibly receive. As far as the city's funds, the leftover funds from the first round of coronavirus relief funds, we have allocated enough to continue the wastewater testing through the end of 2021. So we plan to continue that. We are short on funds if we need to do other things, but we're hopeful that if coronavirus expenses continue to go up or to exist, that we will receive some additional funding.
Okay, thank you.
Sheriff Allen, did you have any questions for Alicia?
No, I don't. Thank you, Alicia.
Commissioner Hill, how about you?
No, I don't have any questions. Thanks, Alicia.
Commissioner Haas?
The only one this is Commissioner Haas. The only one I had on was, funding for any more COVID, and it was answered. Thank you, Alicia.
Dr. Stringham, did you have any additional questions?
No, but thanks very much, Alicia. The graph that you showed showing the lag is just uncanny. It's some of the most convincing data we've seen so far. We were initially a little bit confused when the data didn't seem to show what we were seeing in the community, but the graph that you showed today just says it all, and the news is also really good. So thank you very much.
Yeah, I was just going to say, this Commissioner French, I was going to say, Alicia, today that graph that you showed showing the peaks in it, that first one, boy, the correlation is just undeniable. I mean, if you ran the statistics on that, it's almost a 1-to-1 correlation. It looked like me about a 2.5 week lag. And if that being the case, I think we've got good news ahead of us with regard to infection rate coming up in the next couple of weeks. I could certainly hopeful. Any additional questions out there? Okay. Thank you, Alicia.
All right, thank you.
Go ahead and. We're going to move on to an update from Humboldt County School District. Presentation from Humboldt County School District regarding the latest status of the county school system as it relates to the outbreak of COVID-19. Do we have somebody from Humboldt County School District to present today?
We do. This is Dawn Hagnes, Humboldt County School Superintendent or Assistant Superintendent. I apologize. I don't want to take Dave's role. Can you all hear me?
Dawn. You've got the floor. Thank you.
Great. Thank you. So I've got 3 buckets to talk about today, 3 different conversations. One thing I'll focus on is just the vaccines that have been administered to our employees so far. Our case updates, and then the third bucket is just kind of some actions we've taken or just some additional information pieces. The first thing, and I apologize, I was moving this over so I could talk and see it. The first, as far as vaccine updates go for our staff, and this is thanks to Marcia, thanks to Captain Wilkins for really thinking about Humboldt County School District staff. This is before we even have the opportunity for a pod, but based on what we know right now, as of February 22nd, we will have 23% of our employees will already have received 2 doses of the vaccine. We have an additional, and this is all data as of last Friday, we have an additional 23% of our staff that are waiting for their opportunity to receive the vaccine. We have 8% of our staff right now who have said, no, they don't want the vaccine currently. We have another 8% who are unsure, which we'll talk about in bucket 3 today. And then we have about 38% as of last Friday who have not yet responded to any of the surveys that we have sent out to date. That's on our vaccine numbers. And then I'm going to see, I've never shared a screen, but I'm going to try in Teams to see if I'm able to share my desktop. And it doesn't look, oh, yes, I might be able to here. Maybe not. Are you able to see that?
Go ahead.
You are able to see the timeline I have up?
I was.
Okay. I'm going to try one more time. Otherwise, I'm just going to skip it and I'll keep talking. All right. Is it there now?
Yes.
Okay. So this is the weekly report, if you haven't seen this, that we submit or send out to our school board. We send out to our employees on Fridays, and then we also post on our Facebook pages so that we are as transparent as possible. This is last week's report. As of last week, and I shared this with you, we had 3 new cases last week. Our total cases to date are down below here. As of last Friday, we had one staff member only who had an active COVID-19 case, 64 recovered, and a total of 75 student cases throughout the entire year. I will be working directly with Nicole Maher. We had been reported to be up 2 more student cases. However, I didn't have test dates on those on 2 of our students. And fortunately for our relationship with the Rapid team, when I reached out to them and then contacted the parents, we learned that these 2 students weren't actually positive. They were just in the home quarantining. So we did see just a decrease this last week on our total positive students. And then just because I knew we were starting to see a decline and wanted to be able to see for myself what the change has been over time, I'm hoping you can now see the graph that I'm sharing. And you can really see where my job full-time was COVID there for a while. We had our first bit of spikes in cases back in October. For our first quarter of school, we didn't have any of those concerns. And then all of a sudden there was just that quick spike. And then a dramatic spike in November for a total of 63 cases just in the month of November within our school district. In December, we saw our first decline and a drop down to 45 cases. And I'm so thrilled and hopeful as we see that decline even continue further and down to 26 cases for the month of January. Just sitting on today's call gives me so much hope. I've been watching the posts daily with updates here, and I know that we can't change anything in our school district when it comes to getting more kids back without governor restrictions lifted when it comes to the 3 feet, maybe 3 feet to the high school rather than 6 feet. However, I do have great hope if this continues along with our vaccinations, that we are on the way to some more normalcy in our schools. And I know that that's a win, not only for our community and our families, but man, for our parents and for our employees, or our kids and our employees. So I'm just excited about that. Just a little information about this week specifically in cases. We have had 4 student cases reported this week coming out of 2 families, and no staff positive reports at this point. And then finally, just a couple of my third bucket, just some action points that we've taken. One, I'm so thrilled that we were able to hire our COVID parent school liaison. We interviewed Monday and she started working for us Tuesday. We're very lucky to have Jill Porter on staff. She was a secretary, admin secretary in Washoe County School District for a number of years and moved to be with her family here. So it's nice to know that we have a secretary who lived the experience of COVID in a school last spring, and also brings secretarial experience and communication with our families. And so we're just thrilled to kind of shift some duties her way and have a one place point for our parents to communicate when they have cases, rather than reaching out to maybe 3 or 4 different schools to report information. We are so excited. We had Dr. Jensen and I had a meeting with Dr. Stringham last Friday, and he has committed to doing, as he talked about, an Ask Me Anything Zoom meeting with our employees to really talk about anything related to COVID. But what I'm hoping for is to gather some questions in advance, specifically around the vaccine. When I talked to you 2 weeks ago, we were at 44% of our staff that didn't respond. And we've now dropped that number some. So we're getting more and more people to say yes or no. But we also have that population of people who are unsure if they want to be vaccinated. And so I think just being able to have that opportunity to talk freely and have some questions answered from Dr. Stringham will maybe help with those who are just on the fence and aren't sure what to do. In addition to that, we also found some presentations from the CDC, just information on immunizations and the good it does for our employees, but also just for our community, and provided that to our staff along with just kind of some of the numbers I shared with you, regarding where we are with cases and vaccines within our staff. And finally, just want to thank Captain Wilkins again, and we look forward to when Humboldt County School District employees are on the list for a pod type testing. But we all know, and we've been communicating to our employees, it's only as good as the release of immunizations from the federal government down to the state, and then down into where that plays in the playbook at the community level. So that's all for Humboldt County today.
Great, thank you. Do we have any questions for Dawn? Commissioner Cherry, do you have any questions?
No questions. Thank you, Don.
Sheriff Allen, did you have any?
No, I don't. Thank you, Don.
Commissioner Hill?
No, I don't. Thank you, Don.
Commissioner Haas?
This is Commissioner Haas. Thank you, Don. I don't have any questions.
Dr. Stringham, did you have any additional questions?
No, I sure don't, but thank you very much, and I'm looking forward to working with you on the Ask Me Anything program.
Thank you.
Thank you, Don. I appreciate your update. It looks like we're on the right track and we're heading the right direction. So I'm pleased to see that. At this point, we're going to go ahead and move on to the next item in our list, which is community health nurse update. As consideration, discussion, possible action regarding a request from the county health nurse Marsha Foreman to get assistance from the county health board and county commission with respect to securing facilities related to the dissemination of COVID-19 vaccinations in Humboldt County. It's a request to direct county manager Mendiola to work closely with Ms. Foreman and other providers to remove any roadblocks to securing resources and facilities to complete the vaccination rollout as quickly as possible. Marcia, are you out there? Or is there somebody from the community health nurse office?
This is Susie Esquivel. Marcia is not in today. I know that she has been working with Dave Mendiola about securing the event center for future, possibly having a future COVID pod. As of right now, we don't foresee that happening. We don't think we'll be able to secure the 2,000 vaccines we were hoping to get at the end of the month. But we are still scheduling patients according to their tiers here in our clinic. We already have 3 days that are already booked completely for the end of the month. And once March, we will be doing vaccines every week, both first dose and second dose. So in addition to that, trying to see just regular patients here in the clinic. But something that was said earlier, and I apologize, I don't recall who said it, about reaching out to the rural communities. Marcia and I here in the clinic, every year, we usually do our homebound seniors. So we usually go to their homes. We work in conjunction with Patty from the Senior Center to secure a list of people who are homebound. We go into their homes to do those flu vaccines. And Marcia and I here in the clinic are brainstorming on how we can execute that in the near future, as well as doing vaccines here in the clinic. Obviously, she's not in today. She could have elaborated more on that. As it stands, we have a plan in place to also do the homebound seniors here in this community. I am sure that we could possibly do something in the rural areas as well. I'm not sure if how many on the call know, but we have gone out to the rural areas in the past to do COVID testing as well. So I'm pretty sure that is something we could also do. I don't want to speak for Marcia on that effect. I know she's also pretty busy, as she is the community health nurse in Lovelock, Persian County as well. But I'm sure that there's potential for going out to the rurals and vaccinating those seniors that aren't able to leave their homes.
Great, thank you. Did we have any questions? Is there any questions at all for Rita?
Mr. Chair, Dave Mendiola.
Yes, Dave, go ahead.
I think Sean mentioned earlier that, and I think Nicole as well, that I am talking to a third-party company that may be the answer to our question. They are looking for a pilot county, and they do not want to charge us any money. I hope to have a meeting with them today or tomorrow, but they're trying to pilot this program, and they actually do go to the homes and to the rural areas and do these vaccinations. Again, I don't know, since I haven't had a detailed discussion, I don't know whether they bring their own vaccinations or whether they would have to take a portion of ours, but that would be fine, of course. But they literally, as I understand it, I'm going to get clarification, they will go to homebound, they will go to the rurals, and wherever we need to take the vaccination, and they actually do the vaccination. So earlier was mentioned that maybe they could pick people up and bring them. They may do that too, I don't know, but I do know they actually have the people to vaccinate. So I'll let you know more, hopefully at the next board meeting and or before, how that goes, and we'll decide whether we want to go that direction.
Great, that's a great update, Dave. Thank you. From my part, when I served on the hospital board, and it's been a few years back, I know that our EMS staff were part of a strike team from HGH as far as contacting homebound seniors for flu vaccination as well. And I just wanted to, I noticed we haven't mentioned them at all, and I certainly don't want to, place any expectations on what they could provide, but at one time they provided a service, a vaccination service to homebound seniors in Humboldt County. And I guess I'd like to just get that out there on the table and see if that's a possibility, and maybe between the resources that we've identified this morning that we might be able to meet those needs for those folks that can't get into one of those pods. So, Commissioner Cherry, did you have any further questions?
No questions, just a comment that it's very much appreciated that they're looking at getting to the the very rural part of Humboldt County to seniors, especially not only the homebound ones, but it can be very difficult in the winter to plan to get to town for a lot of these seniors, and to be able to have that service provided out here would be immensely appreciated. Thank you.
You bet. Sheriff Allen, did you have any additional questions?
No, I don't. Thank you.
Commissioner Hill, how about you?
No, I don't have any questions. Thanks.
Commissioner Haas?
This is Commissioner Haas. I have no questions at this time.
And Dr. Stringham, did you have any additional?
Yes, the organization that you were talking about through HGH is called the Community Paramedicine Program, and they have been involved in talks that we've had over the last couple of weeks about having more of a representation for HGH with the vaccinations. So my suspicion is that the Community Paramedicine Program likely will be factored into the mix.
Great, thank you. Do we have any additional questions in the meeting for Rita at this time? Okay, not hearing any, we'll move on to next item is approval of the high-risk mitigation plan. Dave, did you have any report on that?
So, Mr. Chair, Dave Mendiola, County Manager. So this is the plan that we talked about earlier that Nicole and I would sit on with the state, and where the demand, as she said, came to enforce, and not enforce, but to beef up our efforts. They call them enforcement efforts, but we fought back on that for many months, and just simply said we weren't going to do that, and that was never part of the plan. And of course, they continue to put a lot of pressure on us to do something. So that's when the idea was to come up and reinvigorate the business volunteers to go out. So that's what we did. However, now if you think about it here, and again, the untimely letter aside, it's my opinion that there's really no reason to do this. I would suggest, in looking at the positivity rate and the way it's tracking, we probably are going to be out of that high risk category next week, or worst case in 2 weeks, at the current rate and all the great news we've heard. So it is my opinion that we ought to take this out of there completely, and we should scrap this plan to send folks into the community. I mean, because again, although I think it's still a good idea because they do have good information and we do want to get the masks, at the very least, if we want to continue to do that, it would simply be to tell people we have masks and sanitizing liquid, and to offer that to them personally rather than having them make a phone call to the county here. But at this point in time, I see no reason, especially with a pause this week. It could very well be that we're going to be off that list and not necessary for us to report. So that's just my opinion on this at this point in time. Again, it's partly because of the letter and the reaction we got it, but it's also, it makes sense not to be doing this at this point.
Yeah, this Commissioner French, I have to agree. The whole intent of that mitigation plan is to chart a direction that is going to theoretically get our arms around a high risk flagging in our community. And I would just say is that we have been doing that all along. That's why it becomes difficult to actually sit down and write another report, so to speak. Is that we have I simply don't think we have any room right now to actually shift gears and move in a different direction. I think we're headed in the right spot, and I think most of us are comfortable with that. With that. Did any of the commissioners have any questions or comments with regard to the mitigation plan and this item? Dr. Stringham, how about you? Did you have anything at all?
I completely agree with what Mr. Mediola had said. I feel exactly the same way. I think that everything that we've done for the last 10 months has been a mitigation plan. And I think that the concept or the act of filing a document with the state is merely a way to inform another agency of what this agency is already doing. And so I agree. I think that it isn't something that I think we need to place a lot of emphasis on. And ironically, my feeling has been that it does tend to, creating those reports tends to divert our attention away from the very thing that we're trying to do, about which the report covers. So it's better to just do the right things, which I think we're doing. Plus, the other issue is that, I mean, as has been pointed out by a number of people, the data shows that what we're doing is working. And my move would be to preserve relationships with those important community members, our business owners, and to let them know that they're the reason that things are going so well in the business sector. So
I have to agree. Thank you. Any additional comment on this item? Not hearing any additional.
This is Commissioner Hill. I have a question, Commissioner French.
Go ahead.
Yeah, this is Commissioner Hill. I agree. I think we should get rid of the mitigation plan in regards to that letter, as far as sending anybody to any businesses. And if in the future we do have to come up with another mitigation plan, say we do go into the red with the state again, I believe we need to come up with a different strategy to try to mitigate it and report to the state. That's all I have.
I agree.
Fair enough.
Commissioner French.
Sheriff Allen.
Commissioner Cherry, do you have a question?
Am I on? This is Commissioner Cherry.
Yeah, Commissioner, it's yours.
I agree with what everybody is saying. The mitigation, the letter itself, really the thorn in everyone's side is the sending a task team around to the businesses. But there are some things in that plan that I think to benefit that would benefit the businesses, like the county providing the PPEs, sanitizers, those types of things. I don't see that being controversial. We just don't need to be sending anybody into these businesses. So, I mean, other than that, that part of of our plan was really what got everybody's hair up on the back of their neck. But the rest of the plan has some good points to it.
Yeah, I don't disagree with that. Commissioner Haas, did you have your hand up?
I haven't got, this is Commissioner Haas. I agree with Commissioner Hill and Commissioner Cherry. The letter was sent out without the commissioners involved in it, and would like to have the community understand that. Thank you.
Yeah, I don't disagree that there are items within that plan that those services need to continue into the future, especially the PPEs availability. I also fall back on something that Dr. Stringham mentioned, and that is we're pretty short of staff to try to administer what we're trying to get done, all of the moving parts within the county. And the notion that we got to sit down and write a book report back to another bureaucracy in the state, it was raise a hair on my neck, to be honest with you. I just felt like coordination and consultation with those folks in order to try to determine, first off, what challenges we have, and secondly, maybe an exchange of information from them in terms of what we could do, I think is appropriate. But the notion that we got to put some sort of a book report together on a weekly basis in order to keep the state happy has always bothered me along that line. And I get the fact that they're trying to do their job on their end of it as well, but the bureaucracy gets in the way of the services at some point. That's my 2 cents worth. I do agree. I think we probably, the wording in that letter justifiably raised the hair on some folks' necks. They certainly didn't want neighbors turning against neighbors, so to speak. And I don't think that was the intent. But I think certainly there's plenty of room for us to maintain the cooperation within our community and within the business community, so that we can continue to move this in the right direction. I don't think, I'll just say this for the record, I don't think anything, I think it would be the worst nightmare for many of our businesses for them to be flagged as a spreader of COVID-19 based on something they are or are not doing. So I would just say that it's important that we all stay vigilant, and we all, to coin a phrase from the fine doctors, that we need to continue doing the right things. And I think we know what that is at this point. So any additional comments on this item?
Mr. Chair, this is Sheriff Allen.
Sheriff, go ahead.
So, one thing that and I agree with all you guys, I agree with Commissioner Hill, that if we do have to do another mitigation plan, that we take another look. But I think we should offer a voice from the city as well. The city has, 90% of the businesses, and I think that they need a voice at the table somehow. And we do need to let them provide some input as well, because they're the ones who hold the business license for the city. So I do, and this comes a lot with just working with the city police department. We try to respect each other's boundaries a lot and not carry over activity without the other one knowing. But I do think that might go a long way with the city as well. So I just think that they need a voice at the table.
I think that's a great idea, Sheriff. And maybe that's something we can incorporate in the future to involve membership from the city in terms of any shifts in direction along that line, or certainly give them as you say, a seat at the table. Tom, I see your hand up. Are you looking for a comment as well? Commissioner Haas?
No, I just didn't mute it. I'm sorry.
Oh, okay. I saw you were trying to get on. Any additional comments on this item? It was a good conversation to have. You know, we kind of skip over this on week to week, and I think it's I think it was about time that we actually had a conversation about that whole item itself. Anybody on the meeting had have a comment on this?
Well, I
Okay.
guess this Commissioner Cherry.
Go
You know,
ahead.
the letter's out there. What are we going to do about it? Are we going to retract it? Or are we going to change it to where, you know, we get our business confidence back into our government, that there won't be, you know, a team coming around to inspect your business? What are you going to do about the letter that's out?
Dave?
Mr. Chair?
Go ahead, Dave.
I've been working with Nicole over the last 2 days to author a response, and we've kind of put some edits to that. It's really finished at this point, but we wanted to run it by the district attorney's office, and what we'd like to do is make sure that there are no issues or concerns from that perspective. And then obviously it's not on the agenda, so we really couldn't take any action on that today. Otherwise, we would have provided you with that for you to make comments on. So the only thing I would ask is maybe Wendy could give us some direction as to what kind of approvals we need to get before we send that. I would hate for that to be wait 2 weeks to go out. I'd like it to go out now, but I also want to be sure that the board here is in agreement with what's in that response.
I was just going to mention, this is Commissioner French, I was going to mention that anything we do to change that letter, especially this letter and possibly any that are coming following this, should necessarily in draft form make it to the inbox of the seated commissioners and the sheriff right now. Obviously, you know, we're the ones that took a vast majority of the comments and the concerns that came from the public. That's what we're here for. That's we're the contacts for directly to the public. With that in mind, you know, I was reminded by one of our newly seated commissioners yesterday that because they did, you know, have only been on the commission since the 1st of January, that they were unaware of the conversation we had at this point, and they got caught cold on this thing. So I would just say that it's important that all of us get a draft form of those letters before. So with that.
So, Mr. Chair.
Go ahead, Dave.
Dave Mendiola again. I think Mike McDonald's on in place of Wendy. Mike, could you possibly just comment? I have no problem sharing that information. I want to be sure I'm not violating an open meeting law by sharing that before we send it out. So could you give us some direction on that?
I can. This is Wendy Maddox, Deputy DA. I'm here on the call handling this meeting. And it sounds like the discussion that you are having as a board consists of some things that you do want in regard to the mitigation plan. So based on the discussion, I would suggest a motion, and you guys can do what you would like with it. I would suggest the motion be to approve the plan to mitigate the county's status as a high-risk county for COVID-19 as to education and PPEs for businesses, but to exclude 2 components from the plan. And those excluded components would be the volunteers entering businesses and excluding the compliance observation form.
Mr. Chair.
If I may, Mr. Chair, this is Mike McDonald. I agree with Deputy DA Maddox and to the question about, you know, exchanging ideas and deliberating and coming up with a final product. That is part of the definition of serial meeting and action taken without proper notice, which would be in violation of open meeting law. So I think providing the guidance by the commission today by motion. There's nothing wrong with the county manager providing a draft, but if there's input and deliberation over it, then I think we need to have additional agenda item and meeting to discuss it.
Yeah, so be it. I think ultimately, I think what was being asked for by the new commissioners was just an opportunity to see the item prior to the item getting a signature on it and that item going out. Not necessarily have to deliberate, they just need to be informed. Any additional comments? Dave, did you have any?
Yeah, Mr. Chair, Dave Mendiola. And I understand that I just, like I said, we could easily do a couple of things. We could do a special meeting. Earliest we could pull that off, I think, would be next Tuesday, I believe, if we posted tomorrow, that could actually look at the letter and the response, talk about it, and get approval. That way it would be, out in the community within 24 hours after that. That might be our best bet because, as District Attorney McDonald mentioned, I could send it to you, but if you had any questions and or you wanted to edit it and back and forth, that essentially would be in violation of OML. So I guess what I would maybe suggest is I do like the motions that Deputy DA Maddox mentioned, because that is on the agenda to talk about an approval of this mitigation plan. That would at least make a statement that we're going to take that piece out, those two pieces. And that's a good thing. I think we can do that. But with respect to the other one, I think our only choice would be to do a special meeting. So maybe we could just, as either a separate motion or with that motion, that we set a special meeting for next Tuesday. I guess, would it be Tuesday or Wednesday? I always forget. But in any case, that we do a special meeting next week to actually approve that response.
So in this,
Okay.
Oh, can I speak, Chairman French?
Yes, go ahead.
I do see that we have as number 11 future agenda items and next meeting date. So I think that during that time we could set a future meeting if you want to have a special meeting. And as far as posting, we have to have those 3 days of posting. So if you posted by 9 a.m. tomorrow morning, the earliest we could have that meeting would be Wednesday.
I have a conflict on Wednesday, so I won't be able to attend that meeting. What's your pleasure, board? Would you like to take care of this matter in a formal motion today, or would you like to default to a special meeting?
Mr. Chair?
Yes, go ahead.
Mr. Cherry, if I could weigh in one more time. I guess the sending out of another letter is expensive. I don't know that it will get us the results that we are. I do know that just accepting the letter that went out minus the volunteers and minus the compliance letter, striking those out, I think the letter that we have is acceptable and takes care of it and saves the county and a pile of money for mailing out additional letters. That sends the message, I believe, by just taking those parts out of this letter. Because it will cost us
you're
more
in favor
money.
then, Commissioner? You would be in favor then of a motion today, which would strike those two items?
Yes, and go and accepting the rest of the letter as it's written. I mean, it's already went out, but
yeah. What's the pleasure of the board on this? We have a proposal on the floor right now that from Commissioner Cherry that he moved forward with the recommendation from Deputy DA Maddox in the form of a motion today. But I'm interested in what your thoughts are on it. Commissioner Hill, what are you thinking?
Yeah, I think that's a good idea. I guess the other thing that comes to mind is something on the short term, is some sort of statement being released and some, owning up to what happened. I think we owe the businesses that, some explanation of what happened here.
Okay. Commissioner Haas, did you have anything else to add?
This is Commissioner Haas. I think that Cherry has come up with a very good idea on that, of striking those two lines. As well as everybody else involved in this, my phones have been ringing off the hook and been explaining to the public what's happened. Put some Facebook stuff out on my page, explaining what happened and different stuff. But I think that would be a good idea, just to strike those from that letter.
Okay. So Ron, are you interested in moving a motion forward on this item?
Yes, I would make a motion that the letter that was sent out to businesses in regards to our high-risk mitigation plan, that the portions that talked about that has about volunteers be stricken from the letter. The portion of the compliance sheet on the back sheet, that be removed from the compliance letter. And I think that Commissioner Hill's idea of a statement being released regarding what happened and our apologies to the business community also be included in the mitigation plan.
Okay.
I guess, is there anything else that am I being clear on what I would like to see go forward?
DA Maddox, does that get to where you were thinking we needed to go?
Pretty much. I think that if we, as District Attorney McDonald said earlier, if there's any statement that goes out, it needs to be approved by this board prior to it actually being put out. So whether it's in letter form, we can bring that back to you at a meeting.
So basically, the final portion of this motion, the statement released to business community portion, should be in the form of a future agenda item. Correct?
If it's yes, if it's a letter, yes. But I do believe as part of the high risk mitigation plan that the motion that Commissioner Cherry has is appropriate and can be made today.
Okay. Does all the other commissioners and the sheriff, Dr. Stringham, did you, are we pretty much clear on what this motion does and how we're going to move forward with this motion and what it means?
The Sheriff Allen, I am following with you guys. I do agree that would be a good idea. Agree with it for the hazard mitigation plan. But okay. I guess I just want to add that I am the type that I am a very visual person, and if a letter is going to go out to the public, I would like to see that letter prior to it being sent out.
I agree, and in the form of a future agenda item, that's something we can actually have a chance to take a look at as a board and approve.
Yes, thanks.
Okay. Manager Mendiola, did you have something you wanted to add?
Mr. Chair, yeah, Dave Mendiola. Yeah, and again, I would suggest that we really need to have the special meeting. We can deal with that, as Wendy says, in the future agenda items, because even if it's a Facebook post, you need to know what it is. I'm a little sensitive at this point. So, you know, whether it's a letter, a Facebook post, something on the website, you know, I think you all need to approve it. So we need to deal with that part of it. We can certainly rescind those other parts of the letter, but it doesn't do a darn bit of good, in my opinion, unless we tell the community that. So
Yeah,
I think that that's part of the deal.
I have to agree. Commissioner Haas, is your hand up?
No, it's not.
Okay.
I would, Commissioner
Go ahead.
Frank, this is Commissioner Haas. I would agree with striking those parts of the letter. Thank you.
Okay, so right now we have a motion on the floor to strike the portions referring to volunteer and compliance criteria forms within the hazard mitigation plan, and that a statement back to the business communities in the form of a letter be agendized in a future item, so that we can review that letter. Am I wrong on that?
Well, this is Commissioner Cherry. Here again, sending a letter out is costly. I'm wondering if that can't just be done through our county Facebook page, maybe a radio, the newspaper, that type of that in that fashion, rather than sending a letter out again to all the businesses. I'm pretty sure the word's going to get out, but by the time we finish this call, the word's going to be out pretty much everywhere.
I think you're probably right on that, but I just want to make sure everybody that got some heartburn out of this here's what the action of this board was. So we can talk about that item though, and the strategy on how we get that message out in the agendized item, whether it be at a special meeting or as an agenda item in our next regular meeting.
Yeah, I agree with that. We don't need to make that decision today. Yeah.
Okay. So everybody understand the motion on the floor?
This is Commissioner Hill. I just have one question. So we would be a ways out if we agendized the statement. We would be looking at some point next week before we could even address the statement officially.
In order for us to review the letter and there's the statement, as you pointed out, we would have to agendize it to a special meeting, and the earliest we could do that would be Wednesday next week.
Okay. Yeah, I would agree with getting it as soon as possible. I agree with Commissioner Cherry that, you know, people will hear about this, you know, as soon as probably right now, but I think it goes a long ways with people when they can put a face to it and you know, put somebody in that place that's actually speaking, whether it be the commissioners or the county manager. I think it goes a long ways with hearing it right from the source.
Well, I think it's important that the folks understand that we heard what they said, and we're trying to take action as opposed to that with regard to that. So with that, I'll go back to it again. We have a motion on the floor. I'm guessing everybody then is comfortable with the motion and understands it as presented. There are any questions on the motion at this point? Not hearing. Commissioner Haas, did you have something?
No, I do.
Okay. Not hearing any additional questions. I'm going to call for a vote. All in favor signify by saying aye.
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 Any opposed? Motion carries unanimously. Part of that motion involved a release statement back to the to release a statement back to the community in the form of some sort of communication, whether it be letter or whether it be Facebook or all of the above. And we'll take that up at a later date in an agendized item. Correct? Okay.
Mr. Chair, Dave
Yes.
Mendiola, County Manager, we could take that up in future agenda items to at least set a special meeting to approve that, and whatever form you want to do.
I think that was the desire of several of the commissioners, that they wanted it as soon as possible. So, okay. Future agenda items, other than the one we just discussed. Do you have any additional future agenda items? Dave, did you have any?
Yeah, Mr. Chair, Dave Mendiola. I'm going to just make a couple of changes on the language for the community health nurse, but they're inconsequential because we've already dealt with her working with me to get any roadblocks out of the way for a pod. So I'm going to change that. But and then the vaccination language, you mentioned something, I think, when Captain Wilkin was talking about adding something to the agenda. We kind of cover it in his section, but I don't know if you wanted something more specific about the vaccination piece.
Having to do with the community outreach?
Correct. Yeah, we were talking about a lot of things there, but I think, unless, Wendy can opine here, but I think the language is there pretty much covers it if we're talking about vaccinations. But if we wanted to put something specific, just let me know what that is and I'll add it to make sure that we cover it. So when you read it, we'll make sure we cover that specific item.
Okay, I think that would probably suffice. Any item that we already have agendized on a regular basis. Are there any other future agenda items that membership would like to see?
Mr. Chair, Dave Mendiola. So the only other item was the special meeting to review a response to the letter and decide what kind of how we should disseminate that information to the public. So as I said earlier, Wednesday, February 10th would be the earliest. So depending upon schedules, you would just need to tell me, maybe find out what the desire of the commission is.
Okay, I think also with the special meeting and the vote we just took having to do with item 10, I think following that special meeting, we could remove the high risk mitigation plan discussion from future meetings at this stage.
Yes, sir. Got it.
Okay. Okay. Any additional comments? Any on part of the board with regard to future agenda items? Okay, not hearing any. We're going to move to item 12, which is public comment. General public comment is designated for discussion only. Public has the opportunity to address the commission on any matter not appearing in this agenda. However, no action may be taken on the matter until the matter itself has been specifically included on the agenda as an item upon which action may be taken. At this point, do we have any public comment? Not hearing any public comment at this point. I'm going to adjourn this meeting at 11:21 a.m. Thanks, everybody. Great meeting.
Thank you.